My people usually say, Rigakafi yafi magani, meaning prevention is better than cure. Prevention starts with an information, so here's your information for today. What if I told you that one of the most common cancers affecting women can actually be prevented? Yes, cervical cancer is one of the most common cancers affecting women, and it is also one of the few cancers that can actually be prevented, and when detected early, prevented from becoming life-threatening. Welcome to Prevent Before It Starts, a series where we learn how to stop health problems before they even begin. What is cervical cancer? Cervical cancer is a type of cancer that affects the cervix. The cervix, which is the lower part of the womb and also connects to the vagina. Most cases of cervical cancers are linked to the human papilloma virus, also known as HPV. Many people get HPV at some point in their life, but persistent infection with a type of this virus increases the risk of having cervical cancer. Tip number 1. Get HPV vaccine. One of the most effective ways to prevent cervical cancer is through HPV vaccination. This vaccine actually helps to protect against some types of human papilloma virus that can cause cervical cancer. The best time to get vaccinated is before exposure, but you can speak with your healthcare provider to know what is recommended for you. Remember, about 2 years ago, these vaccines were being given at our primary healthcare centers for free to children between the age of 9 to 12 years or 9 to 13 years. So you could actually walk up to any healthcare facility and find out about the HPV vaccination. Tip number 2. Going for regular screening. Cervical cancer actually develops slowly over several years. So regular screening can help to detect early any abnormality or changes before they actually become cancerous. That is why a simple screening can save your life. Don't wait until you have symptoms before getting checked. Simple screening like HPV test and the pap smear screening 3 years or 5 years also can help to save your life. Depending on your age bracket, which will determine the interval of your test, whether it is every 3 years or every 5 years, you can have any one of these two, HPV test or a pap smear screening. But it is best to speak with your healthcare provider to rule out which is best for you. Tip number 3. Practice safe sex. Because HPV is actually spread through sexual interaction, practicing safer sex can actually reduce your risk of exposure to this virus. Remember, protecting your sexual health is part of protecting your overall health, including your cervical. Tip number 4. Avoid smoking. Smoking actually weakens your immune system, which will prevent your body from being able to fight the infection, which will increase your risk of developing cervical cancer. Women who smoke have higher risks of developing cervical cancer than women who do not smoke. Tip number 5. Do not ignore warning signs. Like I said, cervical cancer grows slowly over the years. It does not just happen one day. And yes, in the early stage, cervical cancer may not cause any symptoms. However, there are some warning signs that may appear, which include bleeding after sex, bleeding between your periods, bleeding after menopause, unusual vaginal discharge, persistent pelvic pain. These symptoms are warning signs. They don't always mean cancer, but they should never be ignored. Common mistakes we make regarding cervical cancer. Some women believe that if they are feeling okay and they are healthy, they don't need to go for cervical screening. This is false. Screening is actually meant for people who feel healthy. It is meant to protect you from getting sick. It helps to detect early any abnormality, so you can treat it to prevent you from getting sick. Why prevention matters. Cervical cancer is one of the leading causes of cancer-causing deaths among women in developing countries. The sad part of many of these deaths is they are preventable through vaccination, screening, early detection, and early treatment. When do you need to seek medical care? Visit the health facility if you notice any unusual bleeding, abnormal discharge, persistent pelvic pain, or if you're due for your cervical screening. Early detection can make a huge difference. Cervical cancer is not something we should only talk about when it is advanced. It is something that we should talk about to prevent it from even occurring. So share this information with your loved ones. Let's spread the news about preventing it, screening for it, and detecting it early. I'm Nurse Tiitee, and this is the Health Sisterhood, and that is your information in today's episode of Prevent Before It Starts. Remember, prevention is better than cure.